So this morning, we're very thrilled and honored to have a esteemed panel of two of our local leaders in our county. And as Mackenzie said, please don't be shy about adding your questions in the Q&A icon on your screen. I'd like to first present our first panelist, Dr. Francine Jolton is a board-certified pediatrician and graduate of the Chicago Medical School, who recently retired from Contra Costa Health Services after a 32-year career where she served a consistent clinical role in both the hospital and clinics, as well as numerous committees positions, most notably chair of the Department of Pediatrics for the last 12 years leading up to retirement. Dr. Jolton was also an active member of our System Map Advisory Group and worked diligently to help us develop the tool. Our second esteemed panelist is Supervisor Shanelle Scales-Preston. She is a dedicated public servant and current supervisor to District 5 in Contra Costa. Prior to her role as county supervisor, she served on the Pittsburgh City Council and as mayor of Pittsburgh, in addition to several decades serving in federal government agencies. She also serves as the First Five Commissioner, representing the Board of Supervisors in the Commission. Welcome to both of you. So with that, I'd like to get started with the first question. And just to my team, are we going to feature the panelists at this time and maybe take down these? Thank you. Okay, so I'm going to start with the first question, which will go to Dr. Jolton. Dr. Jolton, what was your experience like as part of the advisory group for this project? I would love to hear your insights.
Well, it was an honor to be there, and I was glad that I was able to participate. So many of the organizations that First Five partners with are names often we see as providers on pieces of paper, but not necessarily, get that human contact. And I think that was really helpful for me as a provider and as an advocate for young children to really get a much better overview of who people are that are out there advocating for children on an everyday basis and are so passionate about it. It also, for me, was a wonderful opportunity to advocate just for the health and well-being of young children. I feel like that is our key to success as a county overall, and to be able to particularly advocate for kids that we don't always talk about as much. And the kids are a little bit more hidden behind the scenes if they're either have housing issues and insecurity and don't access care as much. They don't have as much transportation as everybody else, so no one knows exactly where they are. And most importantly, kids that are vulnerable that we do know, the kids that are in child welfare, they're getting moved around lots of time and definitely need our help. And sometimes it's easier not to include them in a project because it's just hard, but this group chose to continue to work with those complicated groups. And then also kids with complex medical needs that often also get a little bit more isolated than everybody else. And I was a privilege to be able to be part of this group and advocate for those kids in particular that we don't always talk about. So.
Thank you. And we were very lucky and honored to have you. I think your voice as a practitioner and boots on the ground, working directly with families and also healthcare providers, brings such a critical insight to the utility of this map and this tool and the data set that we have. So we thank you for your consistent participation, for showing up, for lending your experience, years of experience and insight and understanding of healthcare challenges and needs, and also for your advocacy. So next, I'd like to go to Supervisor Scales-Preston for the following question. Supervisor, how does data inform policy, funding, and advocacy decisions in your work day to day? And what types of data do you rely on the most?
Thank you. First, I just want to thank First Five and just for looking into this and doing this work. This data is really important because numbers is what drive the funding. It's important to have good data just to understand the specific program gaps that we have in our county. I serve a community that is underserved, underrepresented here in District 5. And so just going over the map and seeing Pittsburgh there is one of the communities where, you know, we need more services there, more need there in Pittsburgh and Antioch. And so that data helps show us the disparities throughout the county. So not just in District 5, as well as West Contra Costa County. And then it shows us the deep inequities that we have, where we all need to figure out how do we come together. And then we all can be working from the same shared data. I think if we're able to do that, then we can truly represent, you know, our county as a whole by viewing this data.
Thank you, Supervisor. And indeed, actually, that is one of our main goals, to be able to have a shared space and tool where we can all have access to relevant data. And for you as a decision maker, I appreciate you highlighting the importance of having access to critical data that can help you not only understand the depth and breadth of needs and challenges in the county, but also help you assist, you know, with the decision making. So thank you for that insight. Dr. Jolton, I also would love to pose the same question to you from a different lens. I'd love to hear from your lens of as a health practitioner over your career and your experience with our county system. How have you used data to do the work that you've done in your trajectory?
Yeah, I think as busy providers in the county, and as you know, it's not an easy, easy job. Every day you get really focused sometimes on the little, piece of the puzzle that you fill, which may be coming to clinic that day or covering a shift up on labor and delivery with, taking care of the newborns or whatever it is. And you lose sight sometimes of what everybody else is doing across the system. And you go to advocate for something, you see my patients that I'm seeing aren't getting X, Y, or Z, but then you realize that's just a small piece of what everyone is trying to grapple with. So I feel like having data helps broaden our lens of how we look at each of our own individual problems or passions, right? No one's is better than the other, but it all has to be put in a big bucket, right? And then decide how do we get it to land. And I'm sure the supervisor knows there's unfortunately not endless funding for all of these things, and I'm sure they would love to fund everything that people come to them with, but they can't, right? So how do you learn about what everybody else is doing, and how you can partner with people to say, wait, we do have common goals here. We're seeing, maybe from a different angle, but we're seeing the similar effects of decrease in funding or not having services here. Or I also think bringing in the disparities is really important. As healthcare providers, I think healthcare providers are getting trained much more about disparities now, but as in my introduction, I am now recently retired, so I'm on the older trained side, and no one talked about health disparities with us, when I was in training. And so that's, an area where I have learned and grown so much in my own personal career. And I feel like data helps tell that story. It just takes away, it's not, it just removes the bias. And I think it's so important that people see the disparities and speak from data and not just from passion. So, yeah.
Thank you. I think we may have just lost Ruth, but that's okay. I'm just gonna step in and continue to ask these questions. I love that response from both of you. Oh, hi, there you are, Ruth.
I'm sorry, we are just pivoting because I had some technical difficulties, but I wanted to continue, and I want to thank you, Dr. Jolton, for that insight. I think both of you have really elevated the importance of not only quantitative data, but also qualitative data for just helping us as practitioners and as leaders in the community make critical prioritization and coordination of resources and services. And one thing that I'm constantly also hear from other partners in our county is that while data is so critical, the realities are like our reality is multidimensional, right? And so not one number can tell a true story to its totality. And so having access to multiple sets of data, numbers, statistics, and also anecdotal data like the one we can find in a map is so critical to get a more thorough understanding of the realities and what we're dealing and getting a true story for what we're working with. So thank you both. So I want to continue with our last sort of question for the panel, and I'll start with Dr. Jolton. Where do you see the biggest opportunity for improving access to services or supports for young children in our county?
You know, this is a in this day and age, this is a tough question, right? Because we all want more opportunities, and unfortunately, we keep feeling the sense of less opportunity, right? There are budget cuts and things happening at the federal level that are, I will say, disheartening is probably the nicest word I could choose right now for all of that. And it's hard. And I really, I couldn't imagine what the supervisor has to do every day and decisions they have to make. And I feel like, you know, it is tough. And I am concerned, and I'm not really sure where the opportunity, I mean, in that sense, I would say I'm not sure, because I'm so concerned about when I heard recently about the large number of public health nurses that received layoff notices in our county. And that's a group of people that I've worked with my entire career. And it's the work, you know, it wasn't the sexy work, right? It's not like we can say, oh, look at the number, look at the thousands of, families that one nurse served, because it's not like that. Because you go into a home and you find, one person with one need, and then you realize that the whole family has needs, and all of a sudden it becomes, a lot of work for a very small number of people. But that difference is immeasurable. Like, that can't be captured necessarily, right? And you just don't want to hear these stories of services being lost that I just do feel are so critical. So I sort of feel like the opportunity really is for us to pick those priorities. Like, where are the priorities? So all these, our partners, we're not all clamoring for many different things and at the end wind up with nothing. Like, do we start speaking together in a more uniformed voice to say, these are the critical things that we, things we see as most critical based on this type of data and discussions we're having, and particularly with the focus groups and what our families are telling us, and knowing we can't do it all, how do we start to do it, and preserve what we can preserve or grow where we can grow, and realize we may lose some things, which nobody wants. It's not because it's not important, but it's like there's not endless funding and endless services and endless employment. And so that's one piece. And I think the other piece for you too is just some way using this to make sure that there's reliable information for everybody, right? That we know this is a reliable source, not just for us, but also for the families we serve. Because the other concern is the lack of trust in the community right now. And so how do we use this type of partnership and data and access to information to make sure our families feel safe, that they feel that vaccines are safe, that getting preventative care is good, that, going to WIC and getting, and getting your nutritional needs met is a good thing. It's not a risk to go there, and, with immigration problems, how do we make sure people know the way to do things and do it safely, and that this group can help build that trust, I would say, for the good information.
Thank you for that, Dr. Jolton. Supervisor Scales-Preston, I'd like to pose the same question to you as well. Where do you see the biggest opportunity for improving access to services or supports for young children in our county?
Thank you. First, I just want to touch on what Dr. Jolton just shared in terms of funding. And it can just be like depressing sometimes with everything that's going on the federal level and how those cuts are trickling down here in our county and how they're playing out right now today. People, community needs these services, right? And so being a new supervisor, I really try hard to sit around my community's voices and needs. And that's just because I'm born and raised here in the city of Pittsburgh, and I was that kid growing up, and so I understand that we need leaders to focus on those things too, because they matter just to regular everyday people. People here in my district where healthcare is so expensive and they're working multiple jobs or non-traditional hours. You know, when we talk about disparities, Dr. Jolton, I'm just thinking about District 5 of Lone, where I have 3 refineries. I have Highway 4, that's like the heaviest traffic here in Contra Costa County. I have a landfill and multiple, you know, industry companies. And, you know, when you think about disparities there, is huge, right? And those disparities play out where in our healthcare system, as you were sharing, when you go to someone's home, it's just not one thing, you find multiple things because that's the community we live in. So we need all of that help and services. And so at a time like this right now, I think, you know, having data is what helps us understand where those funds need to go, where it's most important to go to those communities that needs need to be met right away. And then when you don't have the funding to help serve that, it's also looking at like First Five and other community-based organizations and nonprofits and how we come together to help take care of these needs and working, you know, from whether it's government level, you know, county, city is, you know, and our nonprofits, really building a base of we got to take care of Contra Costa and the community here.
Thank you, supervisors. Thank you to both of you. A couple of really salient points, multiple that you named, but one that really stands out for me is that, yes, right now we are living in very difficult times, making very difficult decisions, and our ability to be able to rely on shared information and understanding of what we're looking at together as a community it's so critical right now, right? And so I know that as a county, we're making a lot of efforts to make civic engagement a lot more dynamic and active. And I believe that using the data can be dynamic too, because it can really lead to, you know, that conversation of dialogue of, because we're all so busy in our own area of focus, in our own day-to-day work. And it is a challenge, you know, whatever role we have, whether, you know, you're doing direct service or not, it is very difficult to constantly look at the totality of the problem. So for me, I do hear also a line of hope in that, and that's one intention with this system map, that it is a tool that is centralized that we can improve and that we can use to continue to make sense and understand the issues that we have and that our families are facing. You also both spoke about the importance of having a united voice to support our joint efforts, right? So I know in early childhood, we always say it takes a village to raise a child. Well, it definitely takes a collective village to problem solve and to bring all of our assets forward and be creative. So I just want to thank you both for your leadership and what you do every day in your distinct roles. And, you know, we look forward to continue to partner with you as we continue to meet the needs that families have in Contra Costa. So we'll now move on to Q&A. I think someone in the team is tracking that. But for that, I will turn it over to Mackenzie, who can tell us if there are any questions. Mackenzie?
Yes, we have just a couple questions.
Yeah.
But if folks want to continue, any participants can continue to drop any questions that you have about the system map itself, or any questions that you have for our panelists or our speaker from Start Early. Now would be the time to do that. So one question that we do have in the Q&A is, who is the intended audience for this system map? And I am going to pose that first to Ruth, and then I can ask Jess to also weigh in from Start Early. And then, of course, if our panelists would also like to speak up, I'm happy to hear from them as well. But Ruth, who is the audience for this tool, this product?
Yes, that's a great question. So I think our intended audience is all of us in different sectors working for families and young children. We did not create the system map thinking about families necessarily because they already have a hard time, they have enough to worry about and understanding, although there's great information there, and families were and providers were part of the advisory group. But really our intent here is to provide access to information to those of us making decisions about the programs, the services that families need, where collaborations need to be made, where funding need to be, brought in, what opportunities are there. So we were thinking about not only the service provider group in the different sectors, but also our elected officials, our funding partners. I think that a lot of as we are trying to face the critical times that we were talking about earlier, having access to quick information and data that can be turned in to a proposal or, a hearing even at the state, right, to kind of elevate the need. I think that's the kind of utility that we're looking at. So the groups are really our funders, our service providers, our elected officials, and our advocates working on behalf of families and young children.
Thank you, Ruth. And Jess, I'm not sure if you have anything you'd like to add about, I know you've worked on these types of product build outs and system mapping, system building efforts across many different communities across the US. So yeah, if you have anything to add about who else could use this product or this tool, we'd be open to hearing that.
Yeah, I think everything Ruth said, and we also really think of the systems map as a conversation starter too, right? A baseline, a foundation for this is the first inquiry. How do we continue the conversations, or where does it point to possibly conversations or further investigation or digging, that things that we want to think about. So we think about it as sort of what's our first glance at what a comprehensive system is across the county, and then think about it as how do you go further than that? What's the initial story, and then how do you dive further into it? So I think that maybe doesn't answer quite the audience question, but or in terms of how we would use it, and it's for whoever wants to continue to investigate and look and think and about these early childhood systems. That's who it's for.
Thank you, Jess. Yes, we are. This is the community's tool. This is not First Five's tool. This belongs to everyone in Contra Costa. So thank you very much for being able to point that out, Jess. We had another sort of small logisticy type question pop up in the Q&A, and that is who will be updating the map and how often will it be updated? And so First Five, in partnership with Start Early, was the one who built this map. We had so much effort and help and man hours across the county and across programs to be able to collect data, help us recruit participants for qualitative inquiry that filled in parts of these that we didn't have hard data for. And so this is a collective effort, but First Five is committed to updating the system map every 2 years on our website. So this particular map functions as sort of the end of 2025's data point. And then the end of 2027 is when you can expect an updated system map to come out from First Five. And I'm sure we'll have more events like this to be able to launch the next version as well. So hopefully that answers folks' questions. There's not too many other questions in the Q&A right now, but I was curious from our panelists if folks can take a moment to put themselves 10 years in the future and imagine a Contra Costa County where every child is supported, every child 0 to 5 is thriving, all their families are well supported, and it's an early childhood ecosystem that is working really, really well. What had to happen in that 10 years, and how did we get there? What is like one policy or funding lever that was pulled or a number of different policy levers or funding levers that were pulled, or anything that you can imagine to get us to that wonderfully functioning system? And what did it take to get there? I know that's kind of a complicated question, but I would love to hear if anybody has thoughts about that imagined ideal future that I think we're all, aiming to get to together. So I'm just going to assign someone. So I'm not sure if Supervisor Scales-Preston, you just hopped off mute.
I'll just go for it. So I think the perfect thing would be is, having funding. I mean, that's what it really boils down to, and making sure that we have, different service providers to be in these spaces to meet the community needs as well. And so 10 years from now, if it was up to me, it would be advocating those 10 years to figure out how we get leaders to see that, supporting a child from 0 to 5 means a lot. Making sure that they're able to read at a third grade level. Once they hit the third grade, those are some of the disparities in my community where they're in junior high and high school, and they're still reading at a grade school, a lower grade school level, which is just unfortunate. And so if we know if a child is able to succeed early on, if we are able to provide those resources early on, they'll be just rock stars, right? And so I think we live in a great community where we do have nonprofits and community-based organizations that do work together a lot. They just need more funding to be able to execute those things. And so advocating, getting our lawmakers to see how important it is, getting them out in the community so they could be on the ground and see how important it is. I think those stories mean a lot, whether they're in Sacramento or in Washington, D.C., and whether they're going to visit, early childhood centers anywhere across the United States, right? It means a lot. And so it has to be a focus from the top as well.
I appreciate that insight, Supervisor. Thank you. Dr. Jolton, I'm not sure if you have something to add about an imagined future.
Yeah, because I may have grandchildren then, who knows? But I agree with everything that's been said. It's such a beautiful thing to imagine, because it's really not just bringing the services to the children and families who need it, but it's also supporting the people that do the work, right? So to be a childcare provider or to be a teacher should be a well-valued career choice that is paid a living wage and gets healthcare benefits and doesn't force you to work 3 of those jobs in order to, right? So to me, it's like, how do we make it just much more healthy community? Because if we do that, our children will thrive, and using children as the first goal is always a good one, right? No, nobody said, oh, no, I want to not fund things for children, right? That doesn't usually go very well. But it's all the pieces that lie underneath of it, right? How do we recruit doctors to come work in the Antioch Health Center, right? And keep it so they can commute there reasonably and be able to, hopefully they speak the same language as patients that they're seeing and those kinds of things. And that's a whole different process than it is maybe to get a physician to go work at some high level, research-based institution. It's just they're different kinds of doctors and they're both needed, but we need to figure out how do we do that piece, right? But it's the same, particularly though, passionate about the teachers and the childcare providers and families having living wages. And so it's like all those pieces have to really be advocated for. I'd like to think maybe we can do some of that work before the next 3 years is up, and our leadership structure, hopefully at the federal level, starts to really change in the lens of how we look at our country and the morality that we look at what we do and the decisions that are made will start to, hopefully the ship will turn and we can get back to something that makes us feel good about waking up every day and doing our jobs. So I can go.
Thank you, Dr. Jolton. There's certainly a lot of work ahead of us, and now and 10 years in the future even. I'm sure there will be additional things that we need to do, but it was really great to hear from both of you, your insights there. So we don't have any other questions in the chat, but another thing that I was curious, and I would love to pass this over to Ruth, if that's okay, and then if other folks would like to join in. I heard both of our panelists speak really strongly about marginalized communities in our county and the disparities that exist in opportunity and outcome for children across different areas, different socioeconomic statuses, what have you. What do you think of the phrase, "there is no such thing as other people's children"? The collective responsibility that we all have in our county to care for all of our county children. I'm curious if you have any insights that you wanted to share that speak to that at all, and how we can broaden that message and broaden the tent, bring people in under that.
Yes, thank you, Mackenzie. And I'm very inspired by Dr. Jolton's and Supervisor Scales-Preston's vision, and I definitely share with them, I ditto their vision. Absolutely, I believe that children are our collective responsibility. They are our future generation. They are the future doctors and teachers. And oftentimes, the reason why we at First Five are so proud of our work, and one role that we have is to be one key broadcaster of the importance of investing early and investing in the early years. It's because our babies cannot do the hard work of advocacy. They cannot go to public comment. They cannot do all of that. They really depend on us to look after them and to recognize that the money we invest early will save us millions of dollars in totality for the entire society in the future. So I think there's enough, data around that in the last, certainly over my career, but in the last 40 decades. So I would say that reframing, not about like the question of like whose children are these, but children are a population of our entire society that is the future, that is the tomorrow. And they really rely on all of us to do that. And it takes that foresight and prioritizing, recognizing that investing early is at the heart of prevention for any country.